There was a big movement in the Bay Area of California to offer to therapists to give them information and teach them about psychedelic therapy. And one of the things I realized in those trainings was that sometimes the things that my clients were struggling with were not going to be solved with talk therapy, that they needed to go further, that there needed to be this idea of the neural pathways, the pathways of our emotions that keep us stuck or keep us feeling things the same way, or even having a trauma in our life and not being able to leave it, that it's always in us, that we're always responding as if it's happening. So when I was introduced to psychedelic therapy, I thought this is a way for me to expand some of my work to provide healing and comfort to people who are really struggling and have been struggling for a while. One of the things that I know about psychedelic therapy is your relationship with your therapist or the person who is bringing you through the journey and integrating what that journey meant to you is critical. The trust that you have for this person is so important to be able to feel like there's a safe container around you to explore where your mind wants to go. But I also have studied a smaller version of psychedelic therapy that's called psycholytic therapy, and I think it's a great place to start. When I offer ketamine therapy to my clients, I like them to start with psycholytic therapy because they get to feel the effect of the medication without going into a deep dive. This is not a recreational journey or trip or getting high. It's not that kind of experience at all. It is an experience that I spend time preparing with my client and asking them sort of their intentions and things that they want to look at, and then working with them to calm them down, to breathe with them, meditate with them, set up a space for them to feel safe, and work within their range of ability to communicate with me. In psycholytic, they'll take a smaller dose and basically they'll be in the journeying experience for about a half an hour, preparing for the journey and closing out the journey, and then integrating the journey is the other part of the time. But with this kind of work, it can deepen even the weekly therapy that I do with my clients because it will bring them to a deeper place than what they're usually talking about. They'll go deeper and they'll investigate more of the situations in their life that have been causing them stress or the things that they repetitively talk about. With the psychedelic journeying, there's more preparation to that, and there's a deeper dive. Usually people stay within the journey experience for about 75 minutes to an hour. And then there's some integration period, but there's a little bit more haziness after the journey. So usually the integration happens a little bit later, like the next day. And there's still intention setting, but there is a deeper feeling of shift in the neural pathways, especially if with the psycholytic therapy that there's been a deepening, but there hasn't been a persistent, consistent change in whatever the client was suffering with. One of the things that I've noticed with psychedelic therapy is that people move much quicker through the periods of life that they felt stuck for a really long time. So if this is something that you've been wanting to look into, don't hesitate to reach out to me and talk with me about it. And perhaps there's some ways that you can focus the work that you're doing on yourself in this technique.